Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
It's Thursday, July 22nd. This is The Gateway. I'm Wayne Pratt. Roughly half a year after healthcare workers in Missouri became eligible for the COVID-19 vaccine, some still need to get their shots.
It's like a tug of war. The first thought that I had was, this happening too fast.
In just a few minutes, St. Louis Public Radio's Sarah Fenton reports on what made some skeptical healthcare workers finally decide to get the vaccine. Governor Mike Parson has appointed a new director of the state agency helping to manage Missouri's COVID-19 response. St. Louis Public Radio's Jason Rosenbaum reports on how Don Karoff plans to tackle the Delta variant.
Parson tapped Karoff to be the director of the Missouri Department of Health and Senior Services. Before taking the job, he held positions within Illinois' public health and emergency management agencies. Karoff is arriving as COVID-19 cases are spiking throughout the state. He says the best way to combat the virus is relatively simple.
This all comes back to people need to get vaccinated. It's a clear answer. People need to get vaccinated. If you don't understand the vaccine or if you need additional information, seek your medical provider, seek your health authority.
Missouri has been without a permanent Department of Health and Senior Services director since Randall Williams' April resignation. I'm Jason Rosenbaum, St. Louis Public Radio.
A $10,000 lottery for vaccinated Missouri residents is part of the state's new initiative to encourage more people to get their shots. Governor Mike Parson says residents with at least one dose of the vaccine can enter the drawing as part of the Missouri VIP campaign. Parson wants the effort to increase the state's vaccination rate, which is hovering at around 40%.
We encourage all Missourians to consider getting vaccinated, as almost all new COVID hospitalizations can be attributed to unvaccinated individuals.
The first drawing is August 13th. They will occur every 2 weeks through early October. The St. Louis County Council could have a bigger say in whether a potential mask mandate stays in place beyond 30 days. County Executive Sam Page says the health department is not issuing a mandate, but it is a topic of conversation. He says attorneys will look into whether a new state law requiring council input for restrictions stretching beyond 30 days applies to mask requirements. County Councilwoman Rita Days says the new state law should give members more say in the administration of COVID-19 restrictions.
Not the fact that we want to upend the mandates or we want to do away with the mandates. We wanted to hear what this process was in coming to that decision. And I don't think that's out of line with what our legislative responsibilities are.
Days was a guest on Politically Speaking. That episode is posted at stlpr.org. Medical school applications for this fall are up by about 22% at Washington University and around 28% at St. Louis University. As St. Louis Public Radio's Kendall Crawford reports, it's part of a national surge of students interested in healthcare after the pandemic.
Many medical school admission officers are dubbing it the Fauci effect. Around the nation, young people inspired by the pandemic are choosing to become doctors. Audra Yeomans is a pre-med student at SLU. She says the effect of the pandemic on unhoused communities shaped her vision of her future.
I really saw the impact, even just the social impact of health and healthcare, and that's really what drove me further into fully deciding that this is what I'm going to do.
The uptick of applicants meant for a very competitive year, says WashU Associate Dean of Admissions Valerie Ratz. Their med school application numbers were the highest in around a decade. And Ratz hopes young people will keep applying. I'm Kendall Crawford, St. Louis Public Radio.
Missouri Attorney General Eric Schmidt will provide details today on how a $26 billion national opioid settlement will affect the state. Several states are involved in this landmark deal with pharmaceutical manufacturer Johnson & Johnson and 3 distributors. NPR reports Johnson & Johnson denies any wrongdoing, but in a statement, the company says the money will, quote, directly support state and local efforts to make meaningful progress in addressing the opioid crisis. Missouri is expected to receive hundreds of millions of dollars in the proposed deal. Illinois Attorney General Kwame Raoul says that state will receive $790 million as part of the national settlement. Healthcare workers were among the first to qualify for the COVID-19 vaccine in Missouri after it was approved in December. Several months later, some healthcare systems in St. Louis report 1/3 of their workers have not received their shots. St. Louis Public Radio's Sarah Fenton reports on why so many are wary of the vaccine and what it will take to change their minds.
Shonda Whitfield saw the effects of the coronavirus pandemic firsthand. She works as a certified nurse's assistant at a long-term care facility in Spanish Lake. She was among the first people in the region to get sick with COVID-19. She has lupus and got really sick. But when the first doses of the vaccine were shipped across the country for workers like her, she didn't sign up to get one, even though doctors say it's safe, effective, and tested in rigorous clinical trials. Whitfield says she was conflicted.
It's like a tug of war. The first thought that I had was, this happening too fast.
Hesitancy among healthcare workers is a huge concern as a new wave of coronavirus cases and hospitalizations sweeps across Missouri. People who work in hospitals and clinics are at a higher risk of catching the coronavirus and spreading it to other people. Whitfield says she knew she should get the vaccine, but she still had unanswered questions. She was worried the shot would make her sick again, and like many of her family, friends, and coworkers, she didn't know if she could trust it.
You had other people like, okay, so how do we not know that 2 years down the line it'll be a recall on it? We have serious health issues.
Others, like Katriva Hart, a nurse at a St. Louis community health clinic, just didn't see the need to get vaccinated because they weren't directly seeing patients.
I'm not in the hospital. I do triage nursing, so most of my patient contact is over the phone. So I just didn't feel like I was in a high-risk population.
Hart and Whitfield are among the nearly 350,000 people in Missouri who work in healthcare jobs. That includes nurses and doctors, but also home health aides, assistants, lab techs, phlebotomists, and pharmacy workers. And like a lot of people, their reasons for not wanting to get vaccinated are all over the map. A recent study of 3,500 healthcare workers in the journal Vaccines found they were mostly concerned the vaccine was developed too quickly, that it's unsafe, and that they can't trust the government entities behind it.
You really can't isolate people from their social and political thinking, even though they work in the healthcare field.
That's Dr. Shefali Wolf, the System Director of Infectious Disease at SSM Health. She says convincing workers comes down to changing one mind at a time. Wolf says enlisting lots of different people to address questions, like whether the vaccine is safe for pregnant people, is key.
It's not just been the infectious disease folks having these conversations. It's really been the OBGYNs that have been participating in some of these conversations about fertility and pregnancy and breastfeeding.
Tori Bayless, the CEO of Maryland-based Luminous Health, told the American College of Healthcare Executives this week that hospital officials and public health experts shouldn't bully or judge other workers.
There's a reason, and if it's your reason, it's a real reason, even if it may not coincide with science or data.
But Bayless says vaccinations are critical to make sure the virus doesn't spread more. She says often many need to hear that their peers and people they trust have gotten vaccinated before they change their mind. In St. Louis, the 4 largest health systems announced they would mandate all workers be vaccinated by the fall. Nurse Katriva Hart figured her clinic might do the same and ended up getting the vaccine earlier this summer.
I just kind of broke and just went ahead and got it because we had some extra doses that day, and so it was just kind of like a last-minute decision.
Shonda Whitfield also got vaccinated after talking to lots of people. Her doctors, her friends, her coworkers, even experts her union brought in during telephone conferences. She changed her mind a few times. She made an appointment, then canceled it. In late May, something clicked while she was driving past the local library.
I looked and I said, vaccination? And it was like, today is the day from 2 to 6.
Everything finally came together. Whitfield had the facts she needed, and when she was ready, the opportunity was right there.
I was scared to death, but it actually went well. I didn't have any side effects, and I went on pretty much with my day.
Many people in her family, including some who work in healthcare, still don't want to get vaccinated. Whitfield says she thinks they could still change their minds. It just might take a while. I'm Sarah Fenton, St. Louis Public Radio.
Our David Casares edited that report. Shula Newman is the executive editor of St. Louis Public Radio, a listener-supported service of the University of Missouri-St. Louis. Music by Ryan McNeely of Adult Fur. I'm Wayne Pratt. This has been The Gateway.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.